Recording from the Sunshine City, St. Petersburg, Florida, overlooking beautiful Tampa Bay, this is the Sonography Lounge, sponsored by Gulfcoast Ultrasound Institute. This podcast is dedicated to medical professionals and patients around the world interested in diagnostic and interventional ultrasound. Our podcast will discuss everything ultrasound, from news, trends, career paths, new technology, and industry updates. Hosted by Lori Green and Trisha Rio of Gulfcoast Ultrasound Institute, they bring over 4 decades of experience in the ultrasound profession and are here to guide you through this journey. Now sit back, relax, and enjoy.
Hey everyone, and thank you for joining us in the Sonography Lounge where we discuss all things ultrasound. I'm Trisha Rio and I'm joined by my co-host Lori Green.
Hey everybody.
On today's episode, as part of our Careers in Sonography, we'll be chatting with Heidi Ehrich about a day in the life of an MSK sonographer. Welcome, Heidi.
Hi, thanks for having me.
Yes, thank you for joining us.
Yeah, absolutely. We're so happy to have Heidi with us today. And why don't we just get started off by having you tell us a little bit about how you got started in MSK ultrasound.
All right. Well, I have been doing MSK ultrasound for 17 years now at the University of Michigan. I started there as a general sonographer, and about that time, Dr. Jacobson and some others were starting to grow ultrasound in the MSK department. So they took up a few techs initially to train with them, and then when I was about 6 years in, I went up to train with the 3 original techs and the MSK radiologist. Did that for about 10 years and decided to give up general and go full-time MSK. We just don't have enough people that know how to do it, so I was kind of needed a little bit more consistently. And then a couple of years ago, I also took on the lead sonographer role in our department, and that kind of brings us up to now.
That's fantastic. You're all right. There's very few experienced MSK sonographers, so to have that opportunity to learn and train, especially with experts like Dr. Jacobson, and put that skill into practice is amazing.
It's a really fantastic opportunity.
Yeah, I mean, I just think about everything you have to learn to become an MSK sonographer. You know, you go into it, if you're already a sonographer, you already have a really strong basic knowledge of ultrasound, but then you have to learn all of that anatomy and physiology of the musculoskeletal system. So I'm sure that plays a role into how it differs, but can you tell us, just in general, how does being an MSK sonographer different from being a general sonographer on your daily basis?
Well, yeah, like you said, it's a whole new set of anatomy and pathology, so that learning that is an enormous undertaking. And I myself had no previous x-ray experience where you learn some of these like bony landmarks and things. So I had to learn, from scratch. I didn't know what a tuberosity was or anything. And those are very important for MSK imaging. You have to learn all this new anatomy, learn the pathologies, and then the actual technique. So instead of like doing broad strokes with a curvilinear probe looking over these, kind of wider areas like the liver, we're looking for anatomy and pathology in a very tiny footprint. So we're looking for very complex anatomy that can be like in the space of a couple centimeters. So we have to really train our eye to slow down and look for really subtle abnormalities. And, just as different as the anatomy and pathology is, our approach has to be a little bit different too, to the way that we kind of get in there and evaluate for things.
Yeah. And would you say it was easier to learn by doing scanning, or did you find that sitting down and kind of reviewing anatomy and physiology from a book helped you more at first?
It really is a combination of those things. So you have to memorize these things, right? So all of that didactic book stuff is important because it's all new terms and all new structures. And, there wasn't really a lot of musculoskeletal ultrasound books back in the early 2000s. So like the Netter Orthopedic Anatomy was like our Bible. And we used to like do coloring pages just to see where these tendons went, from the muscle to the bone. But then, yes, obviously like the hands-on. So sitting with someone who knows what they're looking at, and then, like practicing doing post-scanning and, scanning friends or just whatever, just as a general sonographer would do, but just, as a whole nother set of anatomy there. But yeah, the hands-on is very important as well.
Yeah.
Yeah, absolutely. It definitely is a different scanning technique compared to doing abdominal or OBGYN. Vascular, you're making a little subtler movements when you're scanning, between vessels and so forth. But definitely MSK has its own little.
Well, and then you're scanning on top of bones. So, and
Right.
we just had our blended MSK course these last 2 days. We just wrapped up at 12 o'clock. And I heard one of the instructors telling the participant who was a sonographer, you have to use your fingers to really plant yourself, to give yourself something to hold on to, because otherwise you're just going to keep sliding right off of that bone. And she said that. She goes, it's so different than scanning everything else that I scan, because you just slide right
Yes.
off.
Right.
Yeah.
Right. And, the movements are much smaller when we, take
Yeah.
on new sonographers to train, you just move so fast because you're used to like covering a bigger area. But when we're really talking about like this tendon is 2 centimeters and there's a lot of the tendon that you have to look through, even though it's so small. It's really like the hand movements are very subtle, otherwise you're going to come right off and be all the way out of it.
Yeah.
Yeah. Very easy to miss things if you're not scanning slowly.
Yeah.
And parallel. We learned that
Right.
word, right? The anisotropy word.
Yeah.
Oh, yes, the perpendicular. That's
Perpendicular
a
to
big
the
one.
structure,
Yes,
right?
yes,
Yeah.
yes,
Yeah, that's a big one. First, you have to learn how to say the word.
yes.
Yeah.
Then you have to learn how to avoid
It's a whole
that
new set of
artifact.
everything,
Yeah,
vocabulary
exactly.
and everything.
Yeah.
That's right. As Trisha was talking to you about how it's different from being a general sonographer to an MSK sonographer, how the daily activities and your patient throughput and so forth, I'm sure, is a little bit different than in the general ultrasound department. So, what does a day in an MSK sonographer's department look like as far as that goes?
Yeah, it is slightly different. So at my institution at University of Michigan, we have a very large general department. We have about 70 sonographers, but we also have a pretty good MSK department as well. So we have 9 MSK sonographers. We have 6 full-time rooms running between the hospital and 3 outpatient centers. And then there's another 2 rooms run by the PAs for ultrasound guided procedures. Like general, we would scan, and then we in our hospital show our studies either to a practitioner or a radiologist. For the MSK, it's the radiologists themselves, and we'll look over things and determine if we need to post scan for any additional imaging. And then we also dictate. So our MSK technologists have been trained to dictate cases, and that really helps save time for the staff, that they can just kind of edit and sign off as they need. Occasionally, we also will give verbal reports to clinicians if we have like an in-house add-on, or if the report needs to get to the doctor and our staff is not on site, or if they're busy on another service or something.
Yeah, I know that that probably, as you're learning how to perform ultrasound in musculoskeletal applications, learning how to dictate it, I would imagine, really helps you more than it hinders you. Because when I learned vascular, that's how I learned, was I had to dictate my own studies into a phone. I had to call a number and dictate it, and then it would be reviewed by the radiologist or vascular surgeon who was on call. And I found that really helped me. So do you guys feel like dictating your cases is more of a burden or a benefit in your department?
Yeah, it's definitely a huge benefit. So our MSK techs, they dictate, but it's one thing to kind of like scan and figure out, what's going on to create an imaging story or to explain it to a radiologist. But, it's a whole nother thing to put this in professional verbiage for the clinician or medical legal documentation. So you have to be really familiar with the pathologies and how to describe them in detail. You also have to be very familiar with the differential diagnosis that you might need to give. Sometimes we have to recommend further imaging on something. So over time, you kind of learn what would be the most appropriate study to best suggest for that. But, at the end of the day, the doctor still has the final edit to sign off. So it is, their name on the report. But we have found that it just really helps you grow in your learning and understanding, that you're not just taking the picture. You're able to describe, professionally how to describe this and put it in a report for the doctor, and the patient's going to be reading that later too. So
Yeah.
Right.
And it's very similar to what we do with our worksheets, right? You do your technical
Yes.
impression. It's just a little bit more, I don't know.
It's a little more elaborate because you do
Details.
have to,
Yeah.
generate a report that, more
Meets
it
billing
describes
requirements
it
and
in more detail. And
Yeah.
I know I did the same thing, and when I worked with a vascular surgeon, that we wrote a technical impression in the hospital chart, and then we would dictate a preliminary report, and then they would overread it for us. But it definitely helps you as a sonographer to be more aware of your scanning and your ability to identify pathology and to relay that information in a professional and appropriate manner that can, end up with reimbursement for
Exactly.
or
Right.
for the facility. But I think that's great. But moreover, I think that in your environment and having the opportunity, I would call it an opportunity, to be able to scan the patient, determine what's going on, because you're probably also doing a bit of a physical exam with that, and then detailing out, dictating a report. Your physicians have to have a lot of faith and trust in
a lot of
you,
trust.
and you have to have
Sure.
that highest level of expertise to be able to perform those responsibilities, and
Yes.
so that's kudos to you.
Yes.
Thank you.
That's
And
probably
it
what
really
makes it
does
so
help.
rewarding, right?
Yes. And another benefit is it really helps reinforce your learning and understanding of the verbiage. So, where I'm describing this on a tendon is it's the proximal anterior fibers, like it helps you learn those things as you're, forced to get them correct, right?
Yeah.
But it's a work in progress with the radiologist, and they may have to tweak things a little bit more initially, but as you go on, the sonographers are going to get better and better, and then it is a real time saver for the radiologist.
Yeah. So you just mentioned that they'll go behind you, and when you're first learning, a lot of tweaks and edits are having to be made. Do they come and sit down and talk to you and go over those reports with you and kind of help build that skill, or is this something you guys do on your own?
Well, initially, when we're training new sonographers, they'll usually have a senior sonographer with them, helping them create the verbiage. But we also do recommend, going back and looking at what was changed so that you know how to say it next time, or a particular doctor might like to phrase something a particular way, and just, file that away for the next time as well.
Yes.
But where I came, at U of M, the general sonographers we don't have to create reports at all, because we have residents, we're a teaching institution, and they've created practitioners now for the general side. So they really kind of scan and then, kind of verbally go back and forth, but it's not on the sonographer in the end to describe it. So this is definitely a MSK specific opportunity or bonus at our site.
Right. Absolutely. And, MSK utilizes a lot of dynamic maneuvers in order to sometimes see the pathology that you might not see, and as actually one of the benefits of utilizing ultrasound over MRI. So do you oftentimes have to ask a radiologist or one of the residents to come in to show them dynamically what you're scanning, or do you take video images to be able to present that information?
We do video clips. Our staff are not always on site. Like I said, we have 3 outpatient clinics that aren't necessarily, have staff presence. Sometimes they do at the MR sites, but we predominantly work in cine clips now. We have gotten away from, like 6 still images of a longitudinal biceps tendon. If we can prove that it's normal in one cine clip, that's one image that the radiologist has to look through. And then we take stills to kind of, document pathology and slow them down and be like, I need you to look here at this, but the cine clips are kind of where it's at. And we do all our dynamics, on cine. So they're kind of seeing real time on an image what we're, the movements that we're doing in the room.
Well, that makes sense.
Yeah.
Yeah. How about injections? You mentioned that the PAs, I believe, are doing the injections. Do you have MSK sonographers that assist them with that, or are they using just performing those on their own with ultrasound guidance?
We do not have MSK sonographers in with them anymore. We used to do some procedures at our offsites, and that would be the sonographer and the radiologist, but we've kind of gotten away from that. We have 2 MSK PAs right now, and so they run the procedure rooms, and then they usually have a fellow, because we have fellows in our department, and also a patient care tech. I'm not entirely sure of their exact title, but there is another person in that helps get the room set up and get the patient in there and whatnot. So there's usually a few people already in the room, and our PAs are pretty proficient, so they're really good at what they do, and usually between the fellow and the PA, they have it covered.
Yeah,
Nice.
that's fantastic. You've got quite a robust MSK department there. That's fantastic.
Yeah. And everyone is under a staff, so the staff, especially for the procedures, would be available, if they were needed.
Yeah.
Yeah.
Well, I think that, just hearing your the evolution of your career and moving from general into MSK and many of the opportunities that you have had the advantage of taking advantage of should be exciting for our sonographers who may be listening, but also our other healthcare providers, that the benefits of using ultrasound and MSK are so wide and broad in helping our patients. So I know some people may be a little bit overwhelmed, especially the non-physician.
Yeah.
The sonographers that, like you said, that don't know the anatomy. I was in X-ray before I went into ultrasound, so I got a little bit of the bony. You know your bony anatomy, but you don't learn about the ligaments and the tendons, and there's a lot of names of structures that are very difficult to pronounce, let alone find. So
then adding all the nerves.
the nerves and
nerves
so
and
forth. I think it's something that definitely is doable, and if you're interested in the musculoskeletal world, that you're just going to have to take the time to, like you said, memorize the anatomy, and like anything, there's a learning curve to it, so you just have to be patient and scan, right?
Yes, but it's really interesting and it's really cool, and I loved general, and I do miss babies. I miss obstetric ultrasound. That was kind of like one of my favorites, and liver Dopplers. But MSK is really fun. It's interesting to see, these, tendons connecting the muscle to the bone and how they work. And there is some, oncology stuff to it, but there's also a significant decrease from general. And, some of that stuff can get pretty heavy. And MSK is kind of like, most things aren't, they're painful, but they're not going to end your life. So this is kind of a lighter field to be in that regard.
Yeah,
and point. It's fun. It's interesting and it's fun. So I would encourage anybody, with a little bit of interest. It's really just only going to grow in demand. So it would benefit people to, take that leap into learning it.
Yes, absolutely. It is a very rapidly growing area of our profession. So I know that some of the sonographers out there might also be thinking about what other opportunities might be out there related to being MSK ultrasound trained.
Yeah, so once you're kind of proficient and efficient in this, there's a lot of different opportunities. Obviously, the biggest gap in our world is training, so there's just not enough people that know how to do it. So that there's a lot of opportunities there, because clinicians and insurance companies have learned that, this is effective and efficient. And in fact, some insurance companies have now kind of mandated that you start with an MSK ultrasound before they'll give authorization for MR. So they, it needs to get done. So it's really needed in all imaging settings at this point. I kind of started doing hands-on training courses, teaching at them in about 2007. And that is still a need nationally. Like, I'm sure you guys know that you probably have more people that want to come than you have space for. So that's an opportunity there. There's also smaller independent imaging clinics that would want to offer this. I worked at one of those for about 10 years and did MSK ultrasound for them, kind of like as a side job in addition to U of M. So there's, clinics like that. There's private teaching. Sometimes people will want you to come in and teach at their hospital if you're proficient in this to help their techs along, or, creating educational materials, things like that. So there's a lot of different extra things that you can do once you get skilled in this, for sure.
Yeah, I mean, Heidi herself has written 2 CME Vitals for us.
And they're excellent,
And
by
they're
the way.
amazing.
So you want to check them out.
Yeah. So definitely.
Yes, definitely check those out.
Yes.
She's an amazing writer.
She really is.
Yeah, you can.
Yeah.
Thank you.
Your knowledge definitely comes through in your articles that you've written with us.
Well, not only that,
I hope they're helpful.
Not only that, but also you just have this way of explaining something that even though it may be complicated and it's hard to visualize, you just have a way of saying it where it's like, oh, okay, I can see that. Like I can close my eyes and see that. So that's a definite gift. But.
Absolutely.
Well, that's my hope. And, we have fellows every year in our department. So, since day one, we've kind of, I think I had 1 year to learn, and then I was immediately teaching at conferences and teaching fellows. And, we've we started with 4 then, and now we're up to 9, and we've had a few come and go. So, I've kind of been teaching on the regular. So practice makes perfect, right?
That's true.
Or at least trying to get there.
At 1 year in, that's crazy.
Yeah, that definitely puts you in the position to know your stuff, right?
Right.
So, we've heard from you. You were very fortunate to be taken under the wing of a amazing radiology staff who just, spent the time working with you and teaching you. But there's a lot of people out there who may be saying to themselves right now, I really want to learn to do this. I would love to see my career change, and I would like to go after MSK, who maybe don't have those same opportunities within their departments. So outside of learning on the job, what are some other recommended ways to learn MSK ultrasound in your opinion?
Yeah. So, the one-on-one training with someone who's proficient at is most ideal. And if that can't be in your institution for whatever reason, I would suggest to go to as many hands-on conferences as possible, like the ones you guys offer at Gulfcoast. That really is hugely beneficial because you're getting lecture, you're getting, your hands-on, and you have someone there helping you kind of with your technique. So that's a great option. John Jacobson's book, The Fundamentals of Musculoskeletal Ultrasound, is the best in my opinion. It's just a fantastic foundation of knowledge and information to build on, and it's very clear and concise and not super overwhelming with jargon like sometimes literature can be. So I think, and he has protocols in there and things. So, for the didactic book wise, that's kind of what I would recommend. There's also a lot of online offerings at different places, like at Gulfcoast. They have a lot of online CMEs and just educational materials and videos. I would get my hands on those and just watch those and practice, like if you have your book and, have the anatomy in front of you, if you can just grab a fellow sonographer or anybody available and just, practice and take a look and try to find where these tendons are going and where these structures are located and try to make your imaging match up to what you're seeing. Practice is key. This is a mastery of a whole new set of anatomy, whole new set of pathology, a whole new imaging technique. So it really honestly does take years to master. Don't let that intimidate you. It is rewarding and worth it. But just be patient and keep learning. I still learn every day. There's always something new to learn, some new pathology or a new technique or a structure that we've never been asked to look at before. So, it's an ongoing learning process, but those would be my suggestions. I don't think there's an MSK school just yet, but and those would be a very good start, if you couldn't do it inside your own institution.
Yeah, no, I agree. Those are all really good opportunities to get yourself immersed into it and to really start diving in. And I agree, you have to do the didactics and the hands-on together, which can be difficult for somebody who doesn't have someone to take them under their wing. But like you said, grab a friend, start looking at their anatomy, comparing it to what you're seeing in the literature and the textbooks that you're reading, and see if you can start putting it all together. Where there's a will, there's a way.
Absolutely.
Yes, totally agree.
Yeah.
And, you're really going to have a staff get on board with this too, and ideally, a musculoskeletal radiologist who, has the thorough background in the anatomy and can kind of help translate between ultrasound and MR. What are we seeing? Get confirmation if necessary, but that, is a great way to build, to have that teamwork there.
And I imagine that they have to be invested and believe in the benefit of ultrasound. Right. I know that it's been around for a while, obviously, but I know that some departments maybe aren't quite there yet. Right. So maybe, gauge that as well and be willing to move on if this is something you want to do and maybe your facility isn't 100% there. Right. Have those conversations, try to bring them there, and then if you have to, you just have to be willing to move on and make changes so you can grow and develop.
Yeah. It's going to need to be done, and back again to the insurance thing. Like, this is not going away. It's an effective tool. A lot of times we can get to the final diagnosis just with what we're doing. It's more comfortable for the patients. Yes. It's, more cost effective. Like, this is not going to stop being a thing. So, there are places that are going to need to get on board. And, I would gravitate towards those.
Yeah. I totally agree with that. I was just going to say that, whether facilities want to invest their time and money into training their sonographers or cross-training their sonographers, the insurance part of it is going to, somewhat force that issue. And it's going to require that the management is on board and that they're supportive, and to recognize that this is a new specialty. It has a whole nother set. It's a whole new skill set that takes time to learn. And, practice, we always say it's the friends and family plan. Even if you're not, don't have somebody there at your facility to give you the technical support, at least if you have the support of management to give you the opportunity to purchase the educational resources that you need, attend a hands-on workshop where you can get that skill set so that you can come back and then continue practicing, maybe not even on real patients at first, but or doing patients but having them overread, and maybe you're not billing for them right away until you get to that level of proficiency. But it's the whole friends and family plan. You have your own body that you can scan yours as well. I remember when I first learned how to do DVT scan calf veins, I was scanning my calf veins all the time. So that was many moons ago. But, it's the same thing. Whenever you learn a new technique, it takes time. You have to invest the time on your own. And it's not all on your facility. It's on you as well. As a sonographer, you have to be willing to invest the time to read the books. And John Jacobson's book is excellent, and to invest your time into the learning aspect of it and practice. And if it's a team effort, so if everybody works together, then should be able to get where you want to be in a relatively, the shortest period of time possible for a new technique.
Yeah. And you have to start somewhere. So, and, that's a great place to start. Like, you don't have to start off at level 10. You can start off, scanning yourself, and like you said, not billing for things, but just taking a look. That's probably important when you have staff on board, with what you're doing. But no, I agree with all that.
Yeah. And it keeps your career exciting, right? And just to learn something new and broaden your education. And, even though we've been in the ultrasound profession for a lot of years, we learn new things all the time. So
every day.
It's that's definitely part of the ultrasound profession, is that once you stop learning, then you're going to become stagnant and somebody's going to take your place. So
and it's boring. Who wants to just do the same thing every day?
Right.
You got to step outside your comfort zone, find something challenging, and go after it.
Absolutely.
I'm always happiest when I come home after a day of going, "Whoa, I learned so much today." Like, those are the days that really fulfill me.
Absolutely.
I agree. And I love, and that's something that I, ask for our radiologists at work too, on the lead side, like, what can I do to make, keep us, cutting edge and keep going. So I created a CME conference at my work. So a few times a year, I'll, gather all of our interesting cases and the literature that corresponds to it. And, because not everybody sees everybody else's case, right? We've got 9 sonographers running. So this is a way to, like, share knowledge of it. And when our radiologists go to outside conferences, I'm like, please bring this back. Like, we want to learn. Like, that's the exciting part of our job, is that it's not stagnant. There's always something new and, interesting. So I love that part. I love my job. Been very blessed in this.
Aw, that's fantastic. I think this has been a really important topic because we do like to talk with different sonographers who have different roles in our profession and have gone from, being a general sonographer to other opportunities. And there's a lot of people, especially students who are just starting out, that they may not realize all the different opportunities that are available to them as they grow in their profession. Right. And so it's always nice talking with people like yourself that have taken the extra steps to learn new things and have grown within their profession and are clearly really happy and satisfied. So we really, really appreciate you joining us today and talking with us a little bit about it.
Yeah,
I love talking about this, so I hope everybody can get some excitement for it because it's needed and it's really great.
Yeah,
and it's here to stay, and we're just going to continue growing. So we hope that all of our listeners will continue joining us as well and checking us out because we're always coming out with new things to offer to help in the educational end of things. So I want to thank you, Heidi, for joining us today. It's been a fantastic time discussing this with you, and I want to thank our listeners for joining us as well. And be sure to stay tuned for additional episodes and check us out on YouTube, where you can see our live cam of downtown St. Pete. Yay. We were just talking about that earlier. It's beautiful, sunny, 80 degrees out today. Be sure to watch our podcast videos and check out our hot tips as well. And if you have any suggestions for content, please email us at thesonographylounge@gmail.com. And we'd also love for you to get social with us. So follow us on Twitter and Instagram. And we hope that you have enjoyed today's program. And have a great day and happy scanning.
Yes. Thank you, Heidi.
Thank you, Heidi.
Thank you, ladies, for having me.
Yes. Happy scanning, everybody.
Thanks for listening to the Sonography Lounge. Don't forget, if you like this episode, please subscribe and leave us a review on iTunes, Spotify, or wherever you get your podcasts. You can also find us on Instagram @Sonography Lounge and Twitter @SonographyLNG. If you have any questions, comments, or topic suggestions, feel free to send an email to us at sonographylounge@gmail.com. Have a great week and scan, scan, scan.